Today, having a modern medical practice means utilizing the latest technology. MedCharts is a doctor-designed EMR toolkit that offers a streamlined solution to an often overwhelming process. Our software features include organized patient charts, appointment scheduling, generating e-reports and patient scripts using templates, graphing vitals and labs, importing lab reports, intra-office and patient communication, and billing software for invoicing and credit card transactions. Our user-friendly patient portal allows your patients to have access to their own charts. The best part, MedCharts is free. Let us take care of your practice so you could take care of your patients. Learn more and download our free demo today at medcharts.com.
So our guest today for part 2 in our next series is Dr. Christopher Liu, and he is an MD and a PhD, and that requires a lot of smarts and a lot of study. And today we're talking about, for part 2 in our series of, is going to be the mindsets and skill sets required to leave medicine, and why is this mass exodus of healthcare providers, physicians, why are they feeling this way, that the medicine isn't for them? It's not what they signed up for. It's not what they were promised. I've been used and abused, and I got to do something else. So Dr. Christopher Liu, thanks for being with us here.
Hey, Mike, thanks for having me on the second part of the show.
So I'm really interested in this topic because we do see a lot of rhetoric, and the narratives around healthcare conferences these days are focused around the idea of physician burnout and helping physicians, cope with this. And as you and I talked off air, there's a lot to this. It's complicated. Sometimes it's, and a lot of it's in the mental health field. And we released a playlist just over Thanksgiving for physicians and for doctors that was just an encouraging, inspiring playlist of physicians talking about how to be successful and what they love about their job. And hopefully that is inspiring some others. But we don't see that there's a lot of appropriate handles out there provided by medical institutions, medical employers, hospitals, medical associations are not doing a great job of providing appropriate tools. And so, this is a tough topic to handle. Physician suicide, nurse suicide, those types of things. The pandemic was a pressure cooker for our healthcare ecosystem out there. And healthcare is really, really slow, as you had mentioned off air, slow to move. And I've noticed that too. It talks a big game at conferences like, man, that's awesome. I'm totally going to put that in my practice. And that's said on Friday night or Saturday. And then come Monday morning, once they're on an island all by themselves in their own medical practice, the person calls up and says, all right, I'm calling, remember me from Friday? No, that's not going to work. So there's this big talk about healthcare being so innovative and so fast moving, but there's a mindset about, no. That's not what we do around here. So Dr. Christopher Liu, thanks for being our guest. I'm going to let you first talk a little bit about yourself, but talk a little bit about jumping on that grenade I just threw in your room and your insights.
Sure. So I'm a orthopedic surgeon by training. And then in 2016, I transitioned out of full-time practice into more consulting, coaching, I do a lot of speaking and writing, and do a lot of healthcare IT consulting, as well as sit on the advisory board of various foundations. But my exodus from the medical profession in 2016, I was able to do that through my multiple passive investments that I started building back in 2002. So those really helped me. And right now my impetus is to advocate for financial literacy and wellness towards physicians. And so that's why, I do these guest podcasts, to share and give back and contribute my knowledge. With regard to the question, I do see, like we were talking about in the earlier segment, the healthcare profession moves very slowly. So, I think a lot of because of the broken healthcare system, a lot of the issues such as physician burnout, suicide, career exodus, inequalities, all of these issues are coming into the mainframe because right now the system just really isn't sustainable. So, these issues are being brought to light. I do see, for example, a lot of healthcare hospitals. I think they're doing something about it, but it's not exactly the most effective or efficient way. So that's why you see a lot of physician entrepreneurs start getting into coaching, into wellness, into addressing things such as physician burnout, addressing physician finances. So you're starting to see a lot. The mainstream dialogue is to have to advocate more for physicians.
And so our guest today is Dr. Christopher Liu, and you can connect with Dr. Liu at the links above and below. And please, I encourage you to do so. If you have an entrepreneurial inclination of saying, you know what, I'm curious about real estate investing, or I'm curious about consulting work, or I'm curious about getting on, my local community board or volunteering, my expertise, but I also want to be properly, reimbursed for it as well, or paid for it. There's nothing wrong with that. I think that's something that we need to talk about, is the mindset of, I'm a physician and I have expertise. Like, I took a lot of debt and I took a lot of arrows in the back and in the front to get to where I am today. And I feel bad about getting paid for it. Let's talk a little bit about how doctors can overcome that. Is it wrong to feel like you should be paid for your expertise? And why is that? How do physicians overcome that?
Yeah, so that's one of the limiting beliefs among physicians is actually asking and getting paid for what you're worth. So that manifests in a lot of different situations. So, for example, a lot of physicians just fresh out of training, either residency or fellowship, they're afraid to ask. They're afraid to negotiate. They don't know how to negotiate. So as a result, a lot of times their first job right outside of residency or fellowship, they're underpaid because they don't have that skill of asking and negotiating for what they're worth. I don't see that in other professions, including law or business, because I think as a cohort, those professions, they're not afraid to talk about finances or money or to ask.
Is it unethical? I mean, what's the ethics around that are being taught in medical school? Is it something that's taught as saying it's unethical for you to do that? I mean, the Hippocratic Oath, married with the Golden Rule, we talk about that here in concierge medicine, and it's like, oh, well, I guess that makes sense.
Yeah. It's not really addressed, but what it is, it's sort of almost like a silent code where so for example, during your medical school interview, when you're getting interviewed, there's certain things that they say you should not bring up during your interview. And the number one question that you get asked during your medical school interview is, why do you want to become a doctor? And if you say, I want to become a doctor so I can become well paid, you're shooting yourself in the foot. So it starts from there. The second thing is that so it's almost a cultural shame and a professional shame to talk about money or finances, or to ask or get paid for, or to negotiate your worth. So right from the beginning, physicians are behind as well, coupled with the fact that, they have, no financial literacy is taught, they're benevolent. That sets the stage in the recipe for what we had last year. And it's ironic because, a lot of physicians, they go into high paying surgical subspecialties, orthopedics, plastic surgery, ENT. So it's almost kind of ironic that this sort of thing happens. I also think it happens on on a cultural and societal level because the money in the financial blueprints that we have as kids. So for example, things such as these ideas, including it's improper to ask for money or to talk about money, or the rich are greedy, or things such as money doesn't grow on trees, that sort of thing. I think that imprints into our subconscious and into our psyche that money is scarce, and it's not okay to talk about it. So like I said, there's a big movement discussing physician finances and letting physicians know it's okay to ask and for what you're worth, and to negotiate as well, because physicians take on almost over sometimes over $500,000 in student loan debt. They're 8 to 10 years behind. On top of that, they have these long working hours, so it's just a recipe for disaster.
Wow. And our guest today is Dr. Christopher Liu, and we're talking about a pretty serious topic, which is the mindsets and skill sets required to be successful outside of your clinical practice. And it doesn't mean you have to leave your clinical practice, because you spend a lot of time there. Maybe you love it there, but you also want another leg, a few other legs. You mentioned in your first part of this series with you, Dr. Liu, your information is above and below as well. We encourage you to reach out to Dr. Liu, ask your questions, write them down. That's another tip for you, by the way, for those listening and watching, is if you have questions for Dr. Liu, a way to be organized and structured, write 3 or 4 questions down and then give him a call and say, I have a couple of questions for you. That's a great conversation starter, a good way to start. If you're wondering I just don't know where to start. I don't know what I want to invest in. I don't know what I have a great expertise, and it's really business minded versus medical minded, but it does talk about healthcare. How do I monetize that? And, again, Dr. Liu's information is above and below. And I think that what we're seeing here in our conversations is that, no one is going to come out and say, no one's going to come out and teach you and help you, hold your hand, unite hearts and hands and say, I will take you to the promised land of great, a great way to be successful in medicine. And we won't ever have to talk about money. You won't ever have to ask anybody for money, and you won't ever have to negotiate. That's something that is it is an acquired skill. You mentioned rich dad, poor dad. I remember talking with a professor, and she was also in precision medicine. And she said, to change the way that we are teaching medical students in our next generation of doctors and healthcare providers, to change what we're teaching, it will not only take an act of Congress, it will take an act of God. And so with that in mind, we see that they're not going to insert, the idea of follow your entrepreneurial bends in your dreams, and I know that might sound really cheesy and weird, but they're not going to incorporate this anytime soon into young education. It's up to you as a physician listening and watching to, read up, get your unofficial PhD, a master's degree, and read about what it is that you're interested in. We did I don't know if you can see it behind me, that Yeti bucket there. We had a red bucket similar to that, just one of those regular buckets that you can buy at any big box store. And we actually used it in a workshop, and we said on the red bucket, it was an educational tool. On the red bucket, we want you to write down as a physician everything that you hate about your job, everything you dislike. And they filled up so many, they filled up the first bucket so quickly that we had to bring in 2 more empty buckets that we were going to use for another course. And then on this bucket, I don't know how Yeti does it, but the engineering behind a Yeti, you and I both know, it's pretty amazing. And they get us to pay quite a bit for that. engineering that expertise that they put in, but we asked them on that bucket, hey, write everything that you love about your job. When you leave here, what is it that you want to accomplish when you get back to your practice, back to your exam room, back to your home and your family, and you say, you know, I really want to follow that thread of real estate investing so that I have another leg to stand on, because I don't know if I can work in this environment where I'm working right now. It's tough. And, you know, this isn't what I signed up for. So I'll let you add some insights on that. I don't really have a question on that one. I think it's just important to talk about and to kind of bring that awkward topic that is taboo and on that is seemingly not unethical, but there's a guilt or a shame, like you said, of, nuh-uh, you're not, if you're a doctor now, you're not supposed to talk about those things.
Yeah. That brings us to a good question, is that in terms of the mindsets on how, you know, physicians can start developing for financial fitness. So one of this is just contrarian thinking. So you can still operate within the medical profession, but, you know, keep an open mind. So a lot of the younger physicians, they're a little bit more open-minded. They're, you know, they embrace technology and new ideas and, you know, change as well. So that's one thing, is just contrarian thinking. The next type of thinking that will really help physicians is entrepreneurial thinking. So that's really outside of the box thinking, innovative thinking, asking really deep and insightful questions, and really getting to the heart of some of the issues tackling the healthcare profession today, and thinking about new and different ways that we can address those, that, you know, a lot of the questions that you brought up currently. The other thing is just a lot of the younger physicians, they a lot of innovation and creativity and technology, and they're combining those in different ways so that they can see how they can best help their patients. So, for example, I've seen a lot of physicians go onto social media now, and, you know, for example, Instagram or YouTube, and start creating videos to help keep their patients engaged. And that's sort of that serves, you know, an educational component as well as a marketing and a branding component as well. So, you know, a lot of physicians are doing different things these days. So we need to get the right now it's a small segment, but, you know, over time it'll continually grow.
And our guest today is Dr. Christopher Liu. He's an MD and a PhD. You can connect with Dr. Christopher Liu at the links above and below, and I'll let you continue that thought.
So the other thing is, I think going through an extreme struggle or a hardship helps physicians in terms of financial fitness and survival. So, you know, for example, for me, for you know, a personal example was, you know, I was always the outsider. So I never fit into I never fit into my high school or college. So, but what that did was it helped me to think of different ways and different ways of thinking and seeing the world. And also it forced me to think of doing things differently so that, you know, I wouldn't, that would ensure my survival, both, you know, physically, financially, and that sort of thing. So, you know, overcoming, you know, something, for example, the pandemic, or, you know, your wake up call, those sort of things, you know, really will help you see and open your eyes and, you know, start looking at the world through a different lens and start planning and preparing accordingly.
And I think what we're hearing is a theme throughout our conversation today in this part 2. And if you go back and listen to part 1, if you missed it, we definitely want to encourage you to go ahead and do that. That will also be in the links above and below with Dr. Christopher Liu. Please reach out to him. We encourage you to do so. You know, but I think the theme that we're hearing is, if you have this inkling, you have to go get it. You have to go learn about it. Nobody's going to come and knock on your door and say, hey, buddy, it's time to learn about finances. It's time to learn about real estate investing. You know, like you said, I think in the earlier podcast and broadcast was, you know, a good time to invest in real estate. The best time was yesterday, and another great time was today, and the best time will be tomorrow too. So I think that your points there are definitely well taken, but they're not going to, don't wait for someone to come knocking to bring the investment opportunity, to bring this idea to fruition for you. I don't know what a good hunting analogy is, but I think that, coming from that Midwestern background, if you want it, you got to go out and you got to slay it and bring it home. And that's what you got to do as far as the education and the mindsets and the skill sets necessary to add additional revenue to your life that will help you. So I want to dive into you. And, you had mentioned in previous conversations, you have many areas where you've diversified your revenue. And when the pandemic hit, you only lost 1 out of 10. What are some popular areas that you're involved in? You don't have to be specific, about where those are or anything unless you want to be. But I think, physicians are probably wondering, like, I'm so busy, I haven't had time to think about tying my shoes. So tell us a little bit about where maybe those pathways are. Where are you putting your intensity?
So I started earlier on, my intensity was focused on passive income streams. So that was mainly through real estate and through equities. So I studied a lot of successful people, the uber wealthy, and those were the two types of investment vehicles that ordinary individuals could use to achieve wealth and gain financial independence and freedom. The other avenue was either through starting a business or becoming an entrepreneur. But like I said, to take an idea and take it to the market and get paid for that takes decades. Sometimes that dream's never realized. So real estate and equities, it's a stepwise process. It's a skill. You just learn how to spot value, and you learn how to take action, and learn how to add and deliver value. So if you can understand that process, then you can become extremely wealthy. You don't need a brand new idea. You don't need to be the next Airbnb or Uber or anything like that. So those three avenues. So that's how I got my financial independence and financial freedom. So once I was able to not depend upon an external source of income where I wasn't needing a job or needing to actively trade my time for money, that allowed me to free up my time to really pursue a larger goal and vision, which was to help physicians, to reach physicians struggling either financially or through to help them through different career transitions. So that's why I started my company. And so the main mission of my consulting company is to fight for and advocate for physicians at all levels of training to get the proper amount of financial literacy and education. And so that message is always the same, but the means and ways of delivering that message are different. So I have various digital products, digital courses, webinars, boot camps, masterminds. I've written 4 books. I do a lot of group coaching, a lot of speaking. So, and then apart from there, like I said, there's so many different ways, as we alluded to in the first segment, as a physician, there's so many different ways of monetizing your skill set and your brand. And then, to keep my foot in the medical profession, I do a lot of healthcare IT consulting as well.
Wonderful. And what are some of those books? I think I've got them pulled up here. I'm going to go ahead and share the screen. I've got them, but before I share, I want to make sure I've confirmed I've got the right Dr. Liu. I've got How I Quit My Lucrative Medical Career. Sounds like you, right? Green cover.
Yeah, exactly.
Got a blue cover with The Physician's Guide to Achieving Financial Freedom. That's also your title?
Yes, the second book was How to Achieve Financial Freedom Through Stocks and Options.
Great. I'm going to share this screen so that people can see these books on Amazon here. So here we have books by Dr. Christopher Liu. You can see them right up here. This is Dr. Christopher Liu. Oh, let me move that. There we go. So those are some of the books we definitely want you to check out. Physician's Guide to Financial Freedom, Becoming a Freelance Writer, Getting Started as a Consultant, using stocks and options, how I became financially free using a simple 3-step stock investing process, how I quit my lucrative medical career and achieved financial freedom using real estate. You can too. And I think do you think that physicians are looking for this unattainable permission to do this? And what would you say to that question?
I would say, in today's age, the sky's the limit. So the only person you need permission from is from yourself. There's nothing holding you back. In the past, before the internet, it was kind of hard because you were sort of limited to, the more of the industrial options. But now with the internet, it's very easy to start a social media channel. You can start once you grow your following and your brand, you can start attracting sponsorships, endorsements, advertisements. So today the barriers to entry are really much lower, and the margins are much higher.
I'm just pulling a couple of books that I think are relevant to what we're talking about here today, because I think there's a lot of interest in career learning and learning what I don't know. And it's, definitely check out the books that, that we talked about with Dr. Liu here. But I think that another good one, I'm not endorsing any of these. I'm not the author of any of these, even though I've written almost 20 books myself, and I know how hard that can be. Yeah. But I think a good one, Now Discover Your Strengths by Marcus Buckingham, is a great book. It even has a lot of self-tests. Marcus Buckingham worked for Gallup, was a C-suite leader over there. And he also wrote the book, First Break All the Rules. Sounds very applicable to our conversations of skill sets and mindsets today. A blueprint for developing and maintaining your personal vision. I like this one. It's since been redesigned in the cover, but Visioneering is a great one. Definitely recommend that. And I think, for a lot of physicians, like we tell you around here, and you probably see it behind me, a great one is Know What You're For by Jeff Henderson. That's a great book. Helps you kind of define a strategy. What's my strategy for life? And then again, this one, I think I ripped the cover. I've read this one so many times. But this one is called The 21 Irrefutable Laws of Leadership by John Maxwell. I think that those are great places to start, in addition to the books I'm going to share here again of Dr. Liu's. These are great places to start, because you have permission to do this. There's nothing holding you back except yourself, and it's okay to have other areas of income. I think that from a lot of the physicians that I talk to, Dr. Liu, there's this pause of, I just don't feel like I'm worthy. And we have this conversation a lot. I know you're out of Houston, and I had this conversation recently. It was about a 3-hour conversation with a physician. It was centered around, you're worth more than people are telling you are. You have value, you have worth, you have significance. And I know it's been beaten out of you, over the years, not physically, but mentally and emotionally and psychologically. But we need people like you out there, physicians and healthcare providers like you out there, because the pandemic has showed we need you out there. You're the superheroes for real. I know that's overused these days, but again, great places to start. Our guest today has been Dr. Christopher Liu. So as we come in for a landing, Dr. Liu, and we'll continue with our third part of our series, and I'll let you tee what that third part of that series is going to be about in just a moment. But what do you want to leave this conversation with for doctors and healthcare providers listening? What do you want them to think, feel, and do with what they've heard today?
Well, like you were saying, really, it's you give yourself permission. So, and that was the one thing. And then the other thing is that you expounded upon was, physicians have worth. So you have to really search and dig and look for that worth in yourself, and then find different ways to either to create or to collaborate or to innovate and to monetize that value, so that you can become a economically viable citizen outside of the medical profession.
Absolutely. And our guest today has been Dr. Christopher Liu. I hope that this has been maybe a bit of an awakening or soul-searching few minutes with Dr. Liu today. We'll put links to all of the books as well as Dr. Liu's contact information. Again, reach out to him, bring some of your questions forward. He's here to help doctors. That's why he's a guest here with us. He's a true docpreneur in the truest sense.